I mean, we're looking at a picture, right? In general, the before, against and. Well, if it's before and after, right? What are they doing to themselves? So, what are the options? It's glowing now. Well, I guess starting like this is the way to go. It's 95. Right at a 90-degree angle. More like this. I had a lot of attention on my words today. Tonight. Yes. But I don't understand how to do that. Well, that's one thing I don't understand either. When it's such a tool, it's just there. I guess they put the needle in there somehow, right? And they go on and on and on and on and on and on. I don't know. Everything, pretty much, everything falls into the structure. Yes, yes, girls. I wouldn't want to get in over my head like that. Everyone's wearing the same thing, right? So ugly. Oh, that's a good one right there. No, no, no. It's all so beautiful, so ugly. How do you get a result like this? Well, it's not hovering. I mean, they took a picture before, they took a picture after. Where do we send the pictures? Yeah, I get it. So it's not. Yeah, there's a lot of that kind of work with the lips including, and especially these profiles right here. It's all Photoshop shadows. So they're not real. Right here even, you see, it's sagged. Yeah, you can't have it go like that in one session. And here he is. Well, look, he's sharp. It's terrible. Subtitles by Dimatorzak. We don't lie at all. Here's a picture of a man coming in and doing me the same way. You and I have to realize that here with this profile Joe, 95% of the photo is Photoshop, so you already have shadows. Photoshop right here emphasized even a couple of words sitting principle when so here is a live person shows like here was, but he does not show the technique itself show after, but like I'm not better stomped, but a little bit, yes, and you also had yesterday, a little bit right away, you can see after the procedure, when we injected the filler. It contours, yes, it emphasizes. So initially we have to realize that Jolie's profile, yeah, now we've talked about Photoshop, yeah, we've got it all figured out, that any of us, anyone can make a profile of Jolie out of any original photo. As far as conscience allows cosmetologists. It's your money, it's your profit. That's what they come to you, pay you money as you say, but it's still individual. We have a contract for the second contract, so we can add another park of demands. Take by cosmetology business very good approach to you help uses it, that money chopping. So that's technically how it's done because it is. That's why I said not 100%, but 95%, because there are actually people who are shown this, the procedure, well, I mean, it's going to show up well on them. Yes. Here you go. And in that case, yes, it can be done. But, again, if my opinion is personal, yeah, that's what it takes to fix a profile like that. We need to go to a surgeon, break the jaw, there, spread it, do inserts, make a bone out. Here and walk around with a jaw like this, 2 months to chew on it, then it makes sense that everything that's been done, I see. And when we try to filler here, it's not always appropriate. So, look, here we go, tech by tech, yeah, writing it down. So, what techniques can we use? First of all, you have to feel this corner with your fingers like we did yesterday, right? We found the corner where you and I are supposed to work. Age clients, by the way, in this area, who still have the beginning of their eyebrows. You put that milliliter in there. And she's got it ripped off at even greater cost, everything else will sag to her. Therefore, older people should not have this procedure done. If she wants to, here are the pictures, you don't have to tell her anything, but use 0.5 syringes. The way we did, to be sure not to hurt the person, so she wouldn't come in and complain that it would make things worse. Poppage pizza. to put her soul at rest. 0.5, 0.5 done, and that's it. So, ideally this procedure is done with one syringe on one side, one syringe on the other side. We're writing, aren't we? Yes, again, if it's an aged client with gaps, it has a lot of room to go, a lot of room for this product to sink in. That's the skin pouch that hangs on your chin, that's where it'll go down nicely. This filer will be like a bulldog. Instead of Jolie's profile, there will be a bulldoggy. So you please don't do that. Always keep an eye out. This procedure, Pro Jolie, is basically for young girls who has dense young tissues that will have the filler lying where you put it. He's not going out. And that's not a 100% guarantee. So, we determine the angle of the jaw. Down here. The bone is right where the bone is, that's what we're going to emphasize. You have the contour plate. Contour, contour, the word contour. That is, we can use high-density fillers to put filler in anywhere to contour. That's kind of the emphasis of the calculation. That is, we can emphasize any area on the body, give it a contour with filler, put it. And here we are. Put the fillet in around this corner to make it longer. Now, look, we've got this bone right here. And you and I need to go over it, over this bone, so that there is a clear contour. As you remember, we are in lip enhancement, emphasizing the contour. Also in Jolie's profile, we can emphasize the line. Where are we supposed to get to? To the middle. Come, to the middle. Allows us the amount of drugs and what we're going to do with it. Now we're going to tell you by technique, then we'll watch. We usually do this one about halfway through. What we have here is that we're going up from the corner. That's the starting point. From the corner we go up. Jaw up and then we go linearly down the jawline. It's been somewhere around 2 or 3. We work hard, don't we? Yeah, the way we usually work. How are you doing? You can go a little deeper than that. A little deeper. But in a way that. Flower, how? So that it contours. I mean, I apologize, that's how they did it. Then follow the outline. Before this one. Yeah. But we're going linear, aren't we? And we don't enter it like this. Wait. So. Ought to him. Up to here, yeah, to see how much medication was left. The same number of drugs. We have to do the same technique on the other side. Remember you had trouble duplicating my points, right? Here, so also fumbled on the other side of that corner, and went exactly the same way up the bone and up the bone to the chin, heading. Going 1, 2, 3, for example. I'll emphasize this. Emphasize this line, emphasize this line. Both sides did. Now, we're not talking about the amount of drug yet, we're talking about the techniques. Both sides made linear, emphasized. Next, remember I drew you a picture like this. I'm a human, we mark this area. Here and at these 3 points and make one point will be directly opposite the original, that is, directly opposite the corner a little bit somewhere 5 to 7 millimeters above the line with which we work 5 to 7 millimeters. Naturally, all of these points should be on the same line, not in a spread, not scattered anywhere, yes, on the same line. Caught the lines and then a little higher. Yeah, and then insert the needle perpendicular to the bone. So we marked these 3 points, duplicated them on the other side of the face. Remember when we used to duplicate? A man is sitting, and we immediately fixed it on both sides with a pen, fixed it with a pen, put the carcass on it, looked at it. Measure straight from the nose to duplicate these points evenly on the other side. We looked at how much of the drug we had left. Calculated to be enough for 6 points. Split how much you're going to have there. So it's different combinations. Either you do 1 syringe, or you take 2 syringes. Different amounts. It's just that you have to realize. Here we went line by line first, then point by point. So, what in this area are we working for? When we have it a little bit more in volume, the shadow will fall more here. That is, more will see the result. On the bone perpendicularly inserted, aspirated. It is safe, but we have here is nothing to fear in principle, but still do it when you go deep. Check the needle into the bone, press neatly on himself, piston pulled away. Look, blood is not coming. If it does not go, then all is well. And push down on the piston. Look at the divisions. How many divisions you've counted under that point of construction vial. Next, another point and the third point and the other side of the line. And so we go on. Next, aspirate, then inject. Then you have to wait a while, or you don't. 10 seconds to keep it quiet. Next from. Here are some lips we have, for example. From the corner of the lips to the edge of the eye. Here's our first rhubarb. From the wing of the nose to the goat of the ear. With your cheekbones, right. That's the second jealousy, yeah. From the wing of the nose to the goat of the ear. From the corner of my mouth to the corner of my eye, to the edge of my eyebrows. That's how it's marked. Next, draw a bisecting line that divides the angle in half. Well, I have a little bit of a problem. This is where the clubs end. In short, I drew so many lines. That's the center line, that's the one we need. That's it, huh? I've got an eye for proportions. So, it was almost. So she opened her nose, proved as an ear from the corner. Okay, it goes over the edge of my eye. And in the middle we draw a bisecting line that will lose this angle. This is your working line along which you will plot the 3 dots. So, look, this is the safe zone where we work. There's nothing to be afraid of here, either. We can do it without aspiration. But you and I agreed that if we go deep, we better aspirate, check. From the corner, we set back about 5 to 10 centimeters more, because here we have a very important nerve and a very important artery. To get even farther away from them, so the showers don't hit them for sure. Here we are from this corner just a little bit more. Retreated. Here will be your first point, and on it with a distance of about 2 centimeters, we make 2 more, it turns out to be a total of 3 points. In the same way, in this procedure you put 1 milliliter, that is, a whole syringe on one side and on the other side. Also 1 syringe here and 1 syringe there. Yeah, it's a big challenge. How come we don't fall lower here and higher here? No, it's the same. It's for the young ones, too. Because this is where he can go. How can you not see yourself like that? Made the cheekbones, made the angle of the jaw. Further into Jolie's profile is another chin. Looking at it makes it sharper. It also elongates the face, making it look thinner. and continues the work in this lower jaw. Remember, if we have excess volume here, it will interfere with the result. So it makes sense, if a person is not in a hurry to go anywhere, whether politicians first bring it all out, work on it, and then let it pass. In a month, in 2 months. Chin up and ask. You got the right technique yesterday, didn't you? Why is that right for me? Why you? Everyone has to do one first. Look, your job is to make this corner here. That is, some kind of technique to inject the filler there. You can bolus, you can fan. So your job is to place the filler in that area to extend the chin like that. And then it's down to the bone. What's left, huh? Yeah, you can bolus to the bone. If I find a bolus. And some are dehydrated. Some people just do bolus splitting. Yes. Well, it's tech, it's unified. You see, we have pain here, we have pain here. And the chin of pain makes sense, too. But it makes sense to make a fan shape to make it sharper. A fan. We find the center point, yes, and we fan the drug, we fill that area with a fan. A fan is when there is one point in the field and multiple spectra. When, whatever we do there, fan are painful, we knead at the end in such a way that this corner is visible. Does Jolie have any questions? Yeah, we did this one. There's a video right here. And how does one get the roaster angle exactly? Only from there. That's when we go up, that's where we formulate. If that's the angle you're worried about, you can add a 4th point right here. More. So you'll have 1, 2, 3 on the bottom to the bottom, and this one up here still. So it's the ear that they want. Come on, Dimitri, tell me again how to do the marking. So, we draw a line from the goat of the ear to the wing of the nose, one line. That's right. The other from the edge of the eye outer to the corner of the eye. We'll take the middle. Spending desecrete. So we can match it. Perpendicular to the chin. Along the line of the eyebrows we do, in the direction of the eyebrows. This will be a line we will not go beyond. It even ends up under her eye. What perpendicular to the chin should be? Perpendicular if you draw the line we got. The bisector divides the angle in half. And this bisecting line should be perpendicular to the mandibular line. Parallel to the mandible. Good. And on the other side, too. Chin. A little more. Checking to make sure they're about the same. Aha. Chin. How are we gonna do this? What do you and your chin want? To keep it sharp. Yeah, it's a little spicy. So you have a dimple here. Aha. Well, then, we'll work under this hole. Yeah. Under this hole. And under it. Bolus no. Bolus. Right away. Fan. Give me a fan. Well, at the end of the day. Fan and then bolus. And then bolus. And right here, with the hole itself, to fill it, a little bit of separation will be necessary, yes. To go where it's going. Here we find the center corner. We're finding the corner. From it, draw a line upward. And draw a line along the chin bone. How are we going to do this? We'll do 3 sleep panes. 3 points. So it's in the corner itself, just to the left a little bit. And along the chin in centimeter intervals. So, what about the purline technique? Yes, and prelinear, meaning we go around the corner to the ear, linearly through. We're putting the drug in linearly. And in the other direction, along the chin, we put a strip too. Here we have 2 syringes. How much will you enter where? Half of it will go on our chin. Half a syringe. Okay, let's say. A lot, 0.3. Yes, 0.3 will do. So we're gonna need the whole syringe for the cheekbones and the chin. 1. So it's going to be, if there's 1 division here, 1, that's 3 divisions, 1, that's 3, you get a total of 6. And that leaves 0.4. Yes, 0.4 on the chin. And we've got 0.5 on the corner. How are we gonna get there? So we mentally divide the syringe in half. And we have to realize that we have half. Yes, for each side. We start doing linear on one side, linear on the other. Next, we'll see how much of the drug is left. We divide it in 2. 2, yeah. And each piece into 3 more colas. Divide. Yes. Oh, that's great. Go ahead. Then let's get started. Opens the drug and let's get started. Especially since your fabric itself is young. She'll be good to wait. 1040 ... Better, 35. She's totally. You thought it was 20. No. Maybe 15 days, or I don't know. Yes, it doesn't hurt at all. Lips would be sick. If they survived the lips of 15 days, they would. Aspiration. You remember, right? Nothing happened. You remember, right? I did an aspiration. May I? Yeah, long. Up and in. Up. There are 2 difficulties here. Thank you. Still now the shares will remain in the ribbon. 6 dots. So then do we do more here, here, and here? This way we'll do like this. We'll include here, here, and it should already be emphasized. There's already a new romance to start. Yes, just a little bit. Can you prove it? Aha. Patch it up. Aha. Aspiration, aspiration. Aspiration, decoration. Aha. That's the way it's supposed to be, right? Yeah. It's as if I'm looking at a bone. Yes. Inhale. Breathe in, breathe in, breathe in. That's it. There's something crunchy in there. That's normal. No, that's where I have it. Don't worry. There's nothing there. It's safe. You're just very afraid. Don't be afraid. We're all checking aspiration. It's an audition. Before leading the fiber, we make sure we hit it right. Checked, then only administering the drug. How are you feeling? Well, that's unpleasant. So that means we're working. It was as if I had been hit there. I'm fluffing myself up. You can tell right away that it's very good. This side is very good. See the difference? Yeah. Are you ready? I'll be relaxing in our shoes. Until we put the drug on hold. If we're doing okay so far on the drugs that we're seeing, I'm suggesting center point 2, here on 1. Prep, B24, charcoal, pulmonic, electric. See you again. Now one here and one on the right now. Thank you. And these injections, they can't affect the eyes, right? No, they can't. Because I just know of cases where we have both colostrums and vision. That's all we got. That's all we got. Yes. After having already done 1.5. I guess that'll have to do. Well, it's beautiful. Thank you. It's on the side. Yes. Another locale. All the explosions. You can see it. Thank you. That's it. So great. This way is so great. There's you, right? Yes. All right, let's work on the chin. And surviving changed the way it was in life. We're working. For example, a little segregation. In the center. From downstairs. There. A little segregation. Separating and straight. He was dragging. No, and we'll divine it here. You do a little dissecting first. Separating without pressure. Yes. Well, push a little. Well, that's good. And then whatever's left will be fine. and up. Good. See, we need a little bit more. Yeah, there, that. Somebody's making those dimples on purpose. Who has dimples? Those who don't, yes, they do. Whoever has it, cleans it up. Gotta change, right? I would do the same. But for some reason, I don't need a pit. Let's get you some lips. Well, no. Good ones, by the way. For some reason, they're soft. We will support you. Locomotive nerves. I made a fan and injected a little more. Can we raise God? It's like a new chin. We've leveled it now, and I take it needs a little sharpening. Yeah. Probably look at it as specialists. Here's like last Jolie, usually the line is emphasized in the chin. So now we have it roughly leveled out, now we need to add more to make it clear. We don't go deep. Same, next one's the same. Ah, well, then it'll level out better. Come on. Show me. Here, in the back. There, see. Tachka is very happy. That's it, isn't it? I'm a little bit on the air. This way. This way, okay. Yes, more. Now, let's pack it up. We're out of both medications. 1 second. Well, let's shape up. Now massage. Oh, not really. Well, I agree. The most important part of the procedure. I was discussing that it wasn't for you. You're not Jolie, are you? No, 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 by accident. Come to the C's, just wipe down and nothing else. Contacts with normal today, you don't need to, tomorrow you can. On your face, you're not sleeping on your head tonight. Oh, on my face. You don't sleep with your face in the pillow. Within 4 zones. Bath, sauna, pool, tanning bed for a week is not allowed. No alcohol, no cigarettes for a week. And the more you don't. Stay awake. In fact, be beautiful at all times. So don't sleep. And today, let's say, as I understand it correctly, you can't naturally be on your side either. Not a desire, because there will be. Try to keep your head straight. Because if you turn on your side, you might, I mean, Jolie's gonna be on the same side. Not quite like that, of course, but you have to try and be perfectly fine.